So what does a pain doctor really do? Ultimately, I have to figure out the source of your pain, identify the target, and find a way to turn it off. And I break that up into three broad categories. You can have chemical inflammation, and that's when you have an acute injury and we offer you an injection of some sort to calm down that inflammation and get you into physical therapy and what have you. But what if that injection works for a little bit and just doesn't give you that full duration of relief? Well, then we start looking at mechanical compression. Is it bone on bone? Is there something pinching a nerve? And so if you've got actual compression, we have to figure out ways to offload those pressure points. But sometimes you may have too much chemical and too much mechanical compression, and that translates into some long-term nerve injury. Well, we can very easily treat that with different simulation techniques to regenerate those nerves. That full picture is kind of how I approach this, ultimately figuring out where your pain is coming from and how do we turn it off to get you back to doing the things that you love.